Well, a couple of stories. I think one really important story has been the creation of assess and restore beds. And it really has demonstrated for a population of patients, and having talked to a number of these patients, these are usually frail, elderly, complex patients with many conditions who have been in hospital for a number of days. The literature would say that for every day a frail senior languishes in a hospital bed, they lose about 5% of their capacity. And sadly, the length of stay, 5 to 7 days. So you're at best, and many are much longer, at best
Right.
losing 35% capacity. That is usually the point at which we assess whether or not they need to go to long-term care. So this model has said, let's create these assess and restore beds and actually put patients after that length of stay into beds with some intensive support to say, let's get your capacity rebuilt so you can go home. And it has been remarkably successful in seeing the vast majority of people go home, the vast majority of people be extremely satisfied with their care. And very few of us say, towards the end of my life, I'm hoping to live in long-term care. It's not what we're hoping for. So anything that we can do that allows people to better engage in services at home and rebuild their capacity. I've had stories, really very touching and emotional stories from patients and families who say, I didn't think I was ever going to see my home again. I didn't think I was ever going to see my dog again. And that's made such a difference. And frankly, while it wasn't driven by cost, it was driven by quality, had huge savings to the system. The last piece, I think, is increasingly the orientation of providers who we're all can get pretty blinded,
Right.
saying, you know what, I work in an emerge, so I know what the emerge problems are. With the bringing together of the system, getting providers who were perhaps not as used to talking to each other on the front line of care engaged has made a big difference. And that's been things like avoiding admissions in the ER, being able to support things in long-term care facilities in other places, doing more community outreach, looking at different kinds of programs and supports. And lastly, it's been fascinating for me to see our staff, many of whom have worked in a sector, long-term care, home care, acute care, academic health science center, saying, I'm really fascinated by the experience. I want to learn more about the sector I don't know that much about, or I want to look at how my sector.
Right.
So some of our head and neck cancer folks have said, I want to understand home care a bit more. So I think the last day or so of our length of stay, I'm not sure what we're doing in hospital we have to do in hospital. And so that group has come together to talk about what if we could ensure there was a warm line in place for patients to call and a very rapid home visit program. Could we get people out of hospital a day early?
Right.
Good quality of care, lower risk of exposure to nasty bugs and other unpleasant things, and cheaper. So the models really are lining up.
So they're thinking more as a system than in silos.
Absolutely.
Right?
Yeah. Starting to, I
Right.
should say,
Yes.
absolutely. They're beginning that process. And the stories are profound. So when you can, when you talk about, 0.56 per thousand population, it doesn't really mean that much to
Right.
us. When you talk about somebody's mother whose quality of life was significantly enhanced by going home and being able to garden, being with her pet,
Right.
being able to see her friends, being able to engage in socially stimulating life, that's a profoundly different discussion. So I think the other thing we've learned out of this is tell the patient story or the client story or the resident story. Don't just tell the statistical story. And
Right.
that's a very emotional and accessible way for most of us to say, that's the system that I want to work in,
Right.
and that's the system that I want to be served by with that kind of attention. For us, we keep trying to go back to our mission and saying dignity and respect are the buzzwords. More than buzzwords, they're the
Right.
foundation of what we do.
Right.
So how is that being lived in the services we're offering? And that's a big challenge, and I think it's a great challenge. But we're increasingly asking ourselves, so what did we do in this process of care that demonstrated dignity for the patient and respect for the patient? And if it wasn't inadequate in those regards, then it's probably inadequate for us to provide.